x-rays, did I? I just felt them with my fingers with that had gloves on them. And I know Shirley did the same. And so here we are with a tool now that we can use to actually see what we were touching. And it's interesting to note, Shirley, that we were tested on our boards, our state boards and my national boards, to touch necks. I had to learn how to touch a neck and to feel fluid going through the neck, which was called the carotid artery, by the way, and the jugular vein.
Yeah.
And I had to feel these little glands that they told me to feel because they might have cancer in them and stones and be stuck from draining and lymphatic tissue and lymphatic nodes. Interestingly enough, that as dental hygienists, we are trained to be investigative type investigators of this type of fluid communication through the body in the upper neck and head. So Shirley, tell me a little bit about why we're not using this, and is there a tool we can finally use to show the dentist that we're not just massaging somebody's shoulders?
Well, this is how I'm going to approach that topic. I was never
Sure.
very good at it. So I the statistics tell us that there's going to be an oral cancer in our chair every week at least once. And I don't know that I ever referred anybody out for a biopsy or the dentist found something in a patient that required to go out for a
Uh-huh.
biopsy. So, right there, it makes you wonder how good really are your fingers. I did, by
That's a
taking
good point.
blood pressure, I sent a patient out so her blood pressure in one arm was almost indetectable on the blood pressure cuff. And then I took it on the other arm and it was normalish, highish, right?
Mm-hmm.
And so I was like, dude, you need to get out of here and you need to go to the emergency room. And sure enough, she had a tumor
Mm.
and it was interfering and screwing up her blood pressure. I pretty much saved her life. Okay.
Mm-hmm.
All in the day in the life, right, of a
Saved her
dental
life. Okay.
hygienist.
Yeah, another
And
day. And
there's a lot of hygienists that also, especially here, thyroid cancers are pretty easily detectable, they tell me. But I was never good at it and I never felt confident in it. And if we're going to be scientifically based, we have to be able to understand that these are not the best tools for that. I'm supposed to be able to feel calculus with a bent wire on this tooth underneath the gums. And that's one tactile piece
right.
of information, which is way different than what you're going to feel in a soft tissue. So now I deal exclusively in soft tissue. The teeth are just an afterthought for me
Mm-hmm.
right now because I'm trying to harmonize these muscles. The teeth are part of the story because a lot of times there's teeth out for having braces, or they have a lot of crown and bridge work, or tooth or implants, or some other things that are jacking up everything without the muscles even knowing. And then here it is 3 years later, and the muscles are like, screw this. I'm tired of helping you out. You need to help yourself. We're going to start sending pain messages everywhere. So, because of the way cranial nerves work, you have, a nerve per tooth. It has some other interactions with other body systems. And so you might have, a fatty liver because this tooth has a crown on it or whatever. I don't know. So those kind of things are extremely difficult to understand. It's not part of our education, the interaction between the teeth, the cranial nerves. We just have to know cranial nerve whatever goes to tooth number whatever, and that's it. We don't really go further, and we don't have time to think about it critically until way after we're out. So
I want to
now,
point.
thankfully, to your
Yeah.
system, you've
Mm-hmm.
kind of put it together. And we have now a camera that shows where problems may may lie and gives us a little bit of a roadmap as to where we should be looking.
Well, I was going to mention the one word we love to hear in dentistry is time. And when we hear the word time, either we get stressed out or we're excited because we have it. but most
I
of the
think it's the
time,
same in all of medicine. I don't think it's exclusive to dentistry.
really. And then who suffers? Not us, it's the patient. How many times have I heard, well, the doctor came in for 5 minutes and,
Yeah.
and was gone.
And the
Five,
hygienist forgot to tell him this part.
yeah. Or the front office came in and said, points at their watch, right? You've said that before. I've had like, quit talking.
Your next
You
person
are
is here.
behind. Yeah, your next one is here. Hint, hint.
Yeah.
So we're on this assembly line of time. Well, what if we could, and I've been talking about this, and maybe this is one of the things we'll talk about today is what is the menu of services in our organization is really old. It's so old. I mean, look at the
We
businesses
never
outside.
retire anything.
No.
What good is flossing somebody's teeth once every 6 months or once a quarter? Really? If they're not going to do it at home, why are we bothering? Because they're not going to
Amen.
do it. You're not going to teach a 40-something-year-old person to suddenly floss their teeth. Why do they need flossing? Nobody is going that level of critical thinking. It's because the teeth are too tight because the jaw is too small, period. That's why.
And what can we do as dental hygienists? And we talked with Lancet about this, our title. What's our title? And what our responsibilities are, and why did we get trained to touch necks and to touch glands and to
Yeah.
touch things
Is
and
that our
and become
primary thing, or really is it polishing? Do we
right.
have to polish somebody's teeth? This has been my little thing for a really long time. I'm like, it doesn't do you really any good. And maybe it makes you feel good, but a lot of people hate the sand. And so screw it. Let's not do it. That's
Well,
not
I
my
think
job.
that's part of the menu, and let's
The
talk a little
old
bit
menu.
about the exploration and the investigative part of our services because we're in an environment, and I pointed this out to several people. Think of the holes on the body. We have holes in our ears, our eyes, our nose. Our lower body has some holes there. But we're in an environment where we're there for hours. I can't think of any other profession that spends as much time in that hole of an area of the body and knows it as well as we do. I'm familiar with it, and we don't have any hesitation going inside there and working in that environment. So, why don't we increase our observational skills and use them to the good of the care of the patient and communication with the healthcare industry in general that doesn't go into that part of the body? I'll mention quickly about a case that had all of his amalgam fillings removed in one visit in an out of country location, and the next month he's in a wheelchair. So, what could have been prevented had we looked and investigated some environment first before he went into that kind of restoration removal and caused and contributed, I won't say caused, but I'll say contributed to
People don't know how everything is so connected.
connected.
They
Yeah.
went down to a foreign or down or over to a foreign country, and they had, what they thought was going to be finally getting rid of these metals out of my mouth, not realizing that heating that metal with the burr to drill it out and inhaling that gas is almost worse than just leaving them alone. And they don't
Yes.
put those things together. They're just so focused on one thing. Nobody's there to help them out.
Well,
You go here
dentistry,
to a holistic dentist and it sounds like it's going to be very, very, very expensive. Well, when you
hmm
see how to do it correctly and not toxify yourself, just like a lot of these other things, this is where the expense comes. One of the things that you a little almost mentioned there was time, and how
yes.
little time the professionals have to communicate with one another, which was where I left off with you last month. We had a person whose array of practitioners never talked to one another. She was in pain, she wasn't sleeping, she was malnourished, and she was supposed to translate everybody's information back to everybody else. How do we get paid as practitioners to communicate with one another. It's never part of the equation. And
Yet,
that's where the patient is getting dropped,
yes.
and these are the outcomes.
Well, the good news is there's an awareness starting to happen about it. But more importantly, dentistry is viewed as a technical
Yeah,
service.
carpentry, micro carpentry.
Yes, microcarpentry. So where does the dental hygienist fit into that other than the tactile sensitivity? But we're in soft tissue and hard tissue. So where's the menu of services and how do we evolve into protecting the patient? It's all about protecting the patient. And like you said before we started recording, that you picked up a pre-medical condition, you referred her to a medical doctor and saved her life.
Yeah,
I did something similar, and we just said, well, it's all in the day of our job. And we didn't think twice about it,
right.
did we?
Nope.
And so where's the breakdown and where can we start to have a conversation to change the direction and go upstream about this role that dentistry needs to play in healthcare? Dentistry is a medical condition. And
Well, it's a
until
medical practice, and so is dental hygiene. And the only similarity between dentistry and dental hygiene is that dental hygiene was invented by a dentist, but it's high time that we break off, call ourselves something different. Our education does not lend itself well to sitting there and just polishing teeth all day and having small talk with people, because what we do is potentially a make or break for those patients.
our screening and investigative skills, once they're utilized, and that's where we're going to talk about the investigative tools that we have. And we'll talk about the benefits of the different types of investigative tools and equipment that we have. And there's more to come.
Yeah,
I think that we're just scratching the surface, and we'll talk about a case that you have, and one of the tools that I've been using since I had to get out of clinical hygiene because my exposure to radiation was uh, contributing to my illness. I realized that through investigative tools, I could still stay in the profession without staying in the profession. So I went into a
right.
non-clinical environment, but I could still use all my training and all my skills and all my observational skills to put together reports for providers to have information that I didn't have, quote, the time to talk about. When they came in to look inside, when a dentist comes into my operatory to check a patient's dental condition, I had very little, if any, time to talk about soft tissue or position of the tongue or airway or breathing or if that was their specialty and they wanted to make a certain type of appliance to a point for the patient to have that kind of service. But what caused the airway to close? What caused the collapsion of the palate in the hard palate and the soft palate wasn't talked about. And this was something in the dental field, we can do more investigation of why it's there. And we have the access, we have the chairs, we have the environment. Why not bring in another tool and that's not so expensive as the cone beam technology x-ray and start investigating what is happening to the head and neck area in the muscles and the nerves using, I'll just say it, infrared imaging. And that is my,
Yeah,
go-to for investigating where the stresses are, the nerve communication stresses are starting to break down. And we call it grinding on the teeth. And that grinding on the teeth is the body's way of saying, I'm out of alignment. And the go-to is the jaw joint. But what if the hips are out of alignment and the neck is out of alignment? And so what we see is, a lot of miscommunication that could be utilized in helping the discussion of whole body healthcare and collaboration, and like what you were talking about earlier. So let's look at your cases
All right. So let's
or
see.
the couple cases that you have taking infrared.
So let me see the best way to do that. Let's just open your Dr. Links. Ah, where'd it go?
Let's see.
There it is.
What I think is real exciting is that, and I keep going back to this, but how much memorization we had to do with anatomy.
Oh, yeah.
And I worked on cadavers. I don't know if you had that opportunity to walk into a
Nope.
room where there's a cadaver, but and microbiology and all the sciences. And I was in what they call pre-dental hygiene courses with pre-nurses and pre-meds and
Mm-hmm.
pre-chiropractors and pre-dentists, and students that were going into those fields, which was exciting because we were all together for the first 2 years. So what you're doing now is taking anatomy, and I would start with the human anatomist so you can get the eyes and the nose, and you would take that to the top. Yeah, so have a human and then dial down so you want to probably click on the white background of the image. So you're in the white background to get the human image because you have highlighted the lung.
Well, nothing is clicking right now, and I think it has to do with my Chrome. So let's see. So there we go. Something just happened. There we go. So I think we're lined up, huh?
Well, I look at the eyes and the ears and yeah, a little bit. Uh-huh.
Maybe here. No, then the
I
eyes
would
don't work.
enlarge the infrared just a tiny bit. So this is a young man who's in orthodontics, what you're
Right.
showing.
Mm-hmm.
And I normally like to get the head, the object of my view. So I enlarge
You enlarge it even further.
oh yeah, oh yeah.
Okay.
And it's a lot of fun when you can, get that. See, the thing that I'm learning is what I have been learning is how much anatomy, how much anatomy that we have forgotten. And and boy, is it a lot.
Well,
you
yeah,
know. And
I
we're
can
in an environment every day
go
working
along with
on
that.
patients, and yet we don't know anatomy enough as we know what the markers are, and we know quick looks, but we're not getting down to why the cold sore appeared, and or why there's grinding. We just see the symptoms, and we start looking at the symptoms and treating them the symptoms.
So we're seeing tension around the mouth. So he has braces. So it
So,
could be that he's forcing his lips together. Is that what we're thinking?
well, the way I investigate, it's so much simpler than just overlaying anatomy. Is first I'm going to look at the biosystems. What's the first biosystem I want to look at for this kid? Is it chemical, mechanical, or electrical systems? So I use the anatomy to investigate those systems. So right now we're looking at if on the lower left you're looking at a little bit of chemistry and more electrical system. If you want to look at the mechanics, then you want to get up higher to the muscles and get to the human face and then dial it down with, yeah, you see, so he's a little mismatched, just a tiny bit in the neck. Um, there you go. Yeah. And then maybe shrink the human a bit, just a tiny bit, just so I get the shoulders a little bit or enlarge it. Yeah. It's
So the issue is that um it's hard to measure the body mass. It's going to be a lot different than, so see, when I put the shoulders back, then the eyes are not right.
right. And we're going to work with that in the software in the future. But for now, it's just kind of, I think you're fine. Just lining the ears or the eyes, kind of
I
get the
prefer to
overall.
line up the eyes, to tell you the truth. Um, so to me, this is kind of where the eyes are. No? Do you want it up or down? He did have a
Well,
lot of hair.
yeah, I'm just saying you want to look at the ears, kind of get an overall. You don't want to lose the shoulders because that's where the neck is.
Mm,
And you want to have some kind of a marker. And that means just messing around with it until you get so good at it, it just comes
mm.
naturally. But it takes practice with a manual. Like you're manually aligning it until um,
Okay. Well, this is, now the eyes are really lined up. So if the shoulders are, I don't know what to do about that.
I usually shrink it so it's a little bit, even yeah. So I kind of get inside yeah, there you go. It's a little better. Uh-huh.
Okay.
Now, what I would do is go to the left, and specifically do you want to find out?
I'm just a general overview right now. This is my first crack at this kid. He has a
Okay.
severe tongue tie. It's all the way to the tip. He cannot reach the palate at all. Plus, he's in braces right now. So,
Well, when you take information about people, that's your observation about his tongue tie. But why is he tongue tied? And
right.
I go back to the beginning of what they want to find out. Why is he there to see you? Does he have a time? His sleep is broken. Is he tired
He
a
has
lot?
all the symptoms of a tongue tie for a 15-year-old. Because when you're 15, you don't notice how stiff your neck is. And then that shows up at about 40. His sleep is not good. He fights sleep.
Okay.
He's,
So what we're hearing are symptoms, not
right,
causes.
right.
So
What's the
what
cause?
you're, yeah, the cause is what we're investigating with the anatomy. And but you always need to ask what the conditions are that generate the symptoms because the symptoms aren't the cause. What's triggering the symptoms is what you're investigating with infrared. And you'll find the answer every single time. Every single time. So if he's locked in orthodontics, then we're going to look at what was he like before orthodontics in the investigation. That's where you get a little bit of a timeline. Oh, I fell off my bike when I was 3 years old and hit my head and we had stitches. Well, that stiffened up the neck. So any of these little accidents that he's had in his lifetime up until 15 are contributing factors to his anatomy,
Mm-hmm.
what you're viewing. In the womb, how was he delivered at birth with forceps? Did he not go through the
He
birth
had a
canal?
long labor. So, we're gathering a pile of data points now.
Exactly.
But
Right.
his main reason for coming was he did have an already identified tongue tie, and there's really no way to recognize where that started from. So his
Well,
mother also has a tongue
uh-huh.
tie.
Uh-huh.
It was released at birth. She was also home birth, so the midwife took care of it as best you can under those circumstances, and her mother also. So we have a genetic thread. I don't know what initiated that thread, and this image is not going to help us with that. Is that true?
Actually, you're looking at the hypoglossal nerve and it could. And the hypoglossal nerve is affected in the in the skull. And the skull, you have to look at the infrastructure of the skull in general. Because the way that the skull is formed and the sutures that hold the skull bones together are the infrastructure for the muscles. Hypoglossal nerve is a nerve that goes into the muscle of the tongue and the genetic positioning of that muscle. So why is it there? And they say DNA, but I think a lot has to do with position. Well, it's not even. I think a X-ray you would see a side shot. Let's look at a side shot with and versus a frontal view, and I think you're going to get a lot of information on the infrastructure in the vertebrae because the way the
Do you want a
vertebrae
side
sit.
view or the back view?
A side view, always a side view. You get that vertebrae.
Which side would you like?
The most intense side that he has, probably
Looks,
his right side, yeah. And that view is going to show you the tension on the vertebrae, and you can see his head is forward. He has a
yep.
forward tilt. So I would first get the human and then size it up. Uh-huh.
How's that?
A little bigger on the infrared. It doesn't have to be exact, but he's what you're looking at is and then the rotate the human. The human's a little bit forward. Oh, yeah, there you go. Rotate it and get it.
Okay.
And I, you know, move the chin a little forward. Yeah, there you go. Yeah,
Well, this
there.
is
That's good right there. What you had. That
this
was.
is this is the appropriate lining up spot is right here at the bridge of the nose. So that tells us that his chin is back. If you go like this, you would imagine is something else is more forward.
Uh-huh.
So this is how they measure against forms in um, orthodontic care and stuff. And you're
Uh-huh.
saying that this is going to be a better. It
Well,
just shows you
what?
how crooked his head is and how forward it is.
Right. Exactly. Yeah. Um. What I see is a just the way that the yeah. Okay. That's now you could look at the muscular anatomy and in the muscular anatomy have the view of the TMJ stress and also the trigeminal. But let's look at the TMJ first. Let's look at the TMJ. Yeah. And I think when you look at the TMJ and you see the stresses, it, and you see also the ligament attachments. Um,
Am I in the right ballpark here? I don't feel like I am.
well, what you did was highlighted the thyroid, so then you won't be able to see the muscles
How
because you
did I
highlighted the
highlight the
gland.
thyroid?
By touching on it. So what you want to do is just touch on the white background just to start your base, and then go to your left side, and then just go use it up and down for getting to the muscles. And uh-huh. So what we have here is stress on the muscles. What you want to do is look at the markers. And I like to get a little bit of, I dial down the infrared just so I can see the body parts a little better as I even come down a little bit more.
This dot is
Even you,
interesting in how it's hovering over this major um,
yes, right.
cardiovascular
Exactly. I'm glad you picked that
inflammation
up.
there.
Yeah. See, and once you start just, it takes practice. It's taken me years to work with this, but You get a feel for the anatomy, and you can take
Mm-hmm.
it all the way down that little far to the right, take it to the down, and then you can just touch on any anatomy part. Now, now dial
Auricular
up the
vein. Okay.
now dial up the infrared, and voila. Do you see the pattern? So that's how you're going to use it in a manual way. Um,
So this is the next vein to get in trouble. So he does have headaches. He did have headaches. It's not so bad right now. Um, okay, keep going.
and it just gives you markers. You can use the infrared to confirm. Oh, that's what's going on. Oh, I see. Look at the compression.
Okay, you were looking at the TM joint. So,
Well, you could do that too. That's the muscle. That's a mechanical. You're looking at circulation now, which is chemical. But yeah, you could, you know,
having
add
trouble
more.
finding it. Where's the TM joint?
You could type it in.
Did I spell it wrong?
Temporal mandibular. That's where you want to. It says temporalis. Um,
Yeah, but we want the bone.
that's a joint.
What's a joint?
Um,
It's a
temporal
bony joint.
mandibular joint.
Yeah.
Yes. So I would type in temporal mandibular joint.
There it is. I did type that in. It didn't like
Oh,
it.
okay.
So I don't know if I misspelled it or whatever. So here's the
Okay.
mandible at least.
Okay.
That's pretty close.
Yeah. And now raise up the infrared, or I say dial it in, but it helps to, there you go. Uh-huh. Well, I would highlight that mandibular muscle there like you did.
Well, I don't know how I got there. I clicked
You
here and
just,
then
yeah.
everything else showed up. So here's the hyoid, and that's not clicking. Oh, I see what's happening. This has to be all the way down. Otherwise, we
Yes,
won't be
it
able to
does.
click anything up here.
Right. Exactly.
So this is why is the parotid on the outside of this bone? Okay, keep going.
Well, I mean, what you're doing now is investigative reporting with
Yeah,
anatomy. This is
yeah.
this is it right here in a nutshell. This is what the time factor element is. This is why we
How does
would
it change if I put it back here like I was hoping? Yeah, it didn't really matter, did it?
no, because what you're looking are for markers,
Mm-hmm.
and in markers in the body that are stressed either mechanically, chemically, or electrically. So, and if you want to make changes, you have to, get the thermal all the way dialed down and then
Yeah.
highlight parts of the body. But what you're looking for is the collaboration of information of stress inside the body that's manifesting with an infrared um, image. And and be specific. So if you're going to look at bones, look at bones. If you're going to look at muscles, look at muscles. So you want to look at his atlas, C1. C1 atlas is one of the most important vertebrae bones in that holds the head, and it holds the head stable or not. Okay, now what you can do now is, but okay, now go to the far right and dial up your infrared. Just go back and forth, and you can see right there as you dial it up, it's keep going. You see it's white, which means he's got a lot of stress on that vertebrae, and that vertebrae houses his head. And what I like to do is dial down the infrared enough so you can see the underlying stresses. You see both. You see the highlight of the infrared and the image of the anatomy, and I take a screenshot. Now, when I take a screenshot, I now have information labeled to show the doctors to say, wow, look at this bone, look at this, or a chiropractor. or a dentist and or a medical doctor, and you've got information now to share with them that's labeled. They love they love this. I've done these many hundreds of times and the doctors absolutely love it because it gives them a roadmap
Gives them
right
one
away.
too. Yeah.
And but it took time to do the investigation. That's where I think the dental hygiene profession will be invaluable going into this direction of investigative reporting, which is amazing. This investigative reporting is amazing because what we're doing is taking the time to investigate, whereas the other professions are treating symptoms. And the person's coming in with symptoms and they don't know why, they're just giving them the treatment for the symptom. They come into our environment, we're familiar with the head and neck area way more than anybody else. And look at those arteries and look at his nervous system, especially under his atlas. If you just took away the bones and the muscles and looked at the nerve compression, especially the vagal nerve, the kid's in bad shape, and he's only 15 and his vagus nerve's being affected. And we know how important that vagal nerve is as far as it communications with the organs and the heart. It's going to affect his lungs and his breathing. It's going to also, where are the muscles in the ligaments in the neck compressing? Why are they there? It's because he's chewing wrong. Why is he chewing wrong? That's what Dr. Fonder talks about in
Yeah.
his dental distress book. He's chewing wrong. The sensories in the teeth aren't firing right. And so now he's collapsed and he's got missing teeth. Like you said, he's going to collapse his, they call it vertical dimension. So now we're looking at engineering. That's all it is. It's just engineering. You built a house on faulty foundation. It can't hold up the house for very long, especially when the storm comes. And the storms of life happen. Car accidents, you know, infections, and I mean, where the body can be resilient is in the structure of communication and balance and synergy. And when you take that away, and it's all in the head and neck area, like Dr. Fonder says, you're now influencing the bottom half of the body. So, I work with a lot of people that do these body works and they say it's from the bottom to the top. And I said, no, it's the top down.
So,
So,
yeah, you mentioned occlusion. And as I was taking the photographs, you see the blue spots on these teeth right here?
yes.
I was like, what are those doing there? Because he wasn't really over closing when his teeth were together. And I was like, what's happening here? Oh, he put that on because he was over closing and his upper teeth were bumping into the brackets. So they put these occlusal bumps in there. And I'm like, that's just weird. I don't know what I want to say about it. And I didn't know what to say about it other than, huh. But you look at his tongue tie. How did he get to be 15?
Well, that's a symptom. What you're looking at is a symptom. Why? And
No,
you
the
said
tongue
you,
tie is not a symptom. The tongue tie is the initiator for all of the symptoms.
but what caused it?
Well, whatever
Birth in
interfered with
embryo, right? In the embryo, right?
in the embryo stage, right?
And
Well,
remember what
and the
Dr. Fonder talks about is the embryo stage is first is the cranial nerves in the teeth, in the jaw, form first before the neural crest fluid in the brain.
Mhm.
So as he's forming, if you look at the bone mass on the left side versus the right side, the bone mass is off. And his whole the bone, and we saw it in the infrared that the structure of the bone formation in the arch is the way he grew up and the way that the everything that in the tongue attached. If you had a magic wand, where would you attach his tongue?
Depends. I would not have it be visible on the mandible. I would
Exactly.
put it down here
Right.
underneath his tongue where it belongs, and I would go back further.
Yeah. So obviously, this is a birth defect.
Yes.
So, and the birth defect is affecting everything else, like what you said.
Right.
So in that birth defect, a team would be required. Someone to do the neck release neurotension of the neck. There would be someone to open up the bottom of the arch of the jaw before you lock him in orthodontics. See, orthodontics is condensing the situation versus you want to expand and get the facial muscles. And then I like what, when they talk about leveling, they use levelers in construction work, right? With liquid.
Yeah. With there's a big joke about it, to use bubble water in the level. And so, but yeah, they do. And they also now use lasers for leveling.
Yeah, and what you're seeing is in this teenager is his leveling is off. And when the leveling is off, it's gonna contribute factors of closed airway and swallowing and collapsing, and he's not level. And as he grows, he's gonna be less and less level. It gets in a car accident, gets rear-ended by accident at a stop sign. I mean, life happens. And he doesn't work with a chiropractor. He's still, in life, and then he's in his 30s and 40s, and all of a sudden,
Yep. Everything
strokes,
up.
heart attacks, yeah, all because the circulation was becoming less and less and less and less and less circulating, and that's a word, but it constricts the fluid, and it constricts the myoshield. Everything around the nerve is compressed by the muscles and the ligaments because of either accidents or even just in birth, like we see with him. Which interesting, I saw a chiropractor with an infant, what was maybe 3 years old, hold her upside down to hydrate the spine and the neck. And she didn't hold her upside down for very long, but she held her
Yeah.
upside down to stretch. And I thought, wouldn't that be great if we all had that growing up? And we lay on our backs and then we use a bottle if they put so all these factors aren't hydrating our spine.
Well, the other component here is that his mother's a vegan or at least a vegetarian. I don't know, does she eat eggs or, some of
Uh-huh.
these other little things in the dark. So right there, to me, that's a pain signal. There's not enough saturated fat in the diet to help maintain the myelin sheath that goes around all of those big nerves. And
Right. Yeah.
they spark. That's how I'm describing it. Just like a wire sparks when the insulation is off.
Good
That's the
analogy.
whole point of
Great
that
analogy.
cholesterol covering, is to keep the nerves from misfiring and to keep the electricity going down the what you call it there, down the nerve axon or
Do
trunk
you
or
know if
whatever.
the teenager had vaccinations or not, the COVID vaccinations? Just out
That
of
I don't
curiosity.
know. I don't put that on my health history. I want to feel people out before I start
Well,
with
the
my,
reason the
yeah,
reason it's showing up in infrared, because it does attack the myelin sheath, and also it also clots in the artery,
the clotting is a real
the
big
clotting in the
story. Yeah.
artery. Yeah, so if he had it, that is also a contributing factor for his circulation issues. But the most important thing to use infrared for is circulation.
If he's 15, he would have been 10. So it's likely that he didn't need to get that vaccine back then. If he was in high school then probably he did get it. But he's pretty active,
Uh-huh.
biking, football, track, stuff like that. But he's also, you know, eating the standard American diet for the most part, even vegan style. Um, corn chips are vegan, you know. All right. So, as usual, this is very interesting. And this is, as a collaboration tool, is pretty impressive. And every time we go through it, I'm like, oh, okay, I got it. And then, then I'm on my own and I'm like, wait, what did she say? How does this go together? So that's pretty good. And I'm building this kaleidoscope of care providers here
Uh-huh.
to make sure that we have enough providers to talk to, and we're not that it's my problem to solve particularly, but it is a problem to solve, is the time required to communicate with multiple, and then are you supposed to do that on your family time? Are you supposed to do it when you could be doing a procedure that makes actual money instead? And that's how it gets pushed aside. So that
You
is,
know how I solved it?
how did you solve it?
Well, by hiring them to have a service. And as I'm having a service with them, depending on the conversation when I meet them, um, they are curious about my work and I'm curious about their work. Are we going to be good collaborative referral um, workers or partners and or team members? So I do an investigative by having their services on taken by me, and I pay for them, and I have time to have a conversation about their services because how else am I going to find out? If I know about their services, I can send. But this way, I quickly assess whether it's somebody that I can work with or not, having the services. And
Well, that's
it,
level one, right? But you still have to talk about patients in, particular. Not every person needs to have a consult with 5 practitioners together, but some do. These 70-year-olds who have tongue ties that show up here, they have a long list of issues and they need a lot of practitioners to get together and give good information. And as the treatment plan progresses, there have to be touch points where you can communicate with these other practitioners again and again. So that's what I'm talking about. That's where the time commitment has to be. And maybe you can do it in 10 minutes. Maybe you can do it with a checklist. Maybe using AI, listening in on the communication as we enter into each particular patient, we can get like a checkoff sheet that we accomplish this, you accomplish that. That means
Mhm.
this is going to happen on my side, which means that's going to happen on the third guy's side. Maybe that's how we're going to have to do it to make it less time sensitive. And as people get better hold of their diet, I think that their symptomology will also start to decrease.
Oh, sure.
And
Yeah.
then that kind of brings me to our next little level that we're doing here at Primal Air, with the help and guidance of Dr. Shalom Samuel. We are going to be offering a carnivore course. So it'll be 6 weeks or 6 sessions, maybe a week apart. We're not 100% sure.
Mm-hmm.
But just to get people warmed up to the idea and have them transition out of so many plants and get their head around the idea that what they're calling food and what they're saying as eliminating whole food groups are not food. um,
Yes.
Everything in the middle of the grocery store, it could be easily categorized as something to eat, and you know only works on the stretch receptors of the stomach to provide satiety signals. And if you keep stretching those stretch signals, they are going to stop working. So now you have an overly full stomach. This was something I was talking to the kid about yesterday. I said, you could eat a family bag of Doritos, no problem. It's like 24 ounces, but try to eat 24 ounces of steak in one sitting. It would take you probably all day, or you would eat the whole thing and not have to eat again for 24 or more hours. You couldn't eat anything else. You would be stuffed, even though it's the same amount. It's the chemistry. It's That's the piece that's like not all the way into everybody's mind. These are not foods. They're just not food. So we need to kind of go back into the super olden days. I'm like, the time before clothes, that's when we were the healthiest.
Time before clothes.
And then when I pointed out that dental decay didn't even show up in the archaeological finds until after the agricultural movement started about 10,000 years ago, everybody's eyebrows are like, wow, really? So then you go a little bit more and you're like, well, before that happened, we only ate scavenged animals and we had to fight the hyenas for all of that stuff. And then we were able to get into the interior of the long bones where the marrow was, which is 100% fat. And then we started to grow our brains, and then we started fire. And then right after that, I don't remember if spears came before or after fire, but we were smart enough to outsmart the animals, which we weren't able to do until we got enough fat in the diet, and it progressed across evolution. Evolution takes frickin' forever, and the changes to the human face have only happened in the last 200 years or so. So it's really, really important to look backwards at what actual food is for humans as opposed to whatever it is they're calling it. We're not eliminating food groups. We are focusing on the food group. Ah,
Well, and I mean, I I use logic in the food
what?
that if you're in living in the winter months, would
Yep.
you eat mango? Because
In the
mango
winter
wouldn't grow
climate,
in the, yeah,
exactly. Be at your
mangoes don't
latitude.
grow in the window. I mean, in the winter.
Right.
So the humans that lived in the different continent of the terrain of the country is where their diet was at that time. There wasn't a Walmart
For
or a grocery store.
thousands of years, not
No,
just, you
right.
know, 100 years. And
So
then you get on a plane and move to Florida, and then you
yeah,
think, oh, I can eat, pineapples all year
right.
long or whatever,
Right.
bananas.
And and it's just fascinating how the terrain and the way, especially with traveling now, you're
Yep.
right. People are going to, we call it snowbirds, they leave the winter
Yep.
and go down. But how the body is adapting to temperatures, because I noticed that temperature plays a big part in the digestion.
Oh, there you
And
go.
so, temperature, it's very interesting. I think what we'll see with the future is knowledge, more information for people to have. And I think the
Clean
most important,
knowledge. We've had dirty knowledge for 2 generations, and that's half of how we got to be so sick in this country.
right? I personally like working with a really good naturopath that has education about screening the body's chemistry in ways, not to put you on a ton of vitamins, but screens your body with muscle testing or screens your body talk because the body innately knows what it needs. And I've used that for years, and that helps my body hone in on where the imbalances are. But I dare say in the future, we're going to have equipment. You just put your hand on it and it tells you right there, no Doritos today, more
Yeah.
fish oil,
Yeah. Yeah. All right, so
whether
we're
we follow it
closing
or
in.
not.
We're closing in on our hour pretty soon
Okay.
here. So, how close are we to enrolling in our school? Can we start enrolling like December 1st? What do you think?
I say we're close enough to do by December 1st. Yes, I do.
Sweet.
I
Let's
think
have that
we're
be a target because if you
a
don't have a
target
target,
December 1st. Okay. I
and
love it. And do we have a name for our school? Upstream Intelligence.
we'll call it UI, Upstream
UI,
Intelligence.
Upstream Intelligence.
Or the VS Victoria Shirley School or whatever we want to call it, and it'll be a hybrid. It'll be in person for a time and online, and I think that it's going to really help people across the country be better communicators with other
Definitely.
providers, and then ipso facto to the patient. the patients are really looking for this. There are the
Oh,
patients that
they
just want
are.
their metformin and leave me alone. And then there are patients that are like, I never want to take another pill. What can I do to never have to have high blood sugar ever again? So that's our target, right? And those
Yes.
people are more and more. Um, I still, my own sister in law and her husband, they're still super traditional and they just want their pills and they just want to carry on. And I'm like, okay, whatever. So, yeah, but that's,
Mm,
you have to go where
yes.
people are.
And people are searching online. And so it's just a matter of time. We'll make the connections. We're in the process and the shifts are coming. And, a lot has to go to the, gratitude of COVID for waking people up.
Right,
So
right.
it worked to our
It
advantage.
did give people time to really wonder and
Mm-hmm.
the squelching of the opposing viewpoints was so obvious that even people who weren't looking could see it.
Right.
So some of that is gone. Some of that has none of it has been apologized for. And but I think we're a little bit safer saying non-traditional things, and
Mm-hmm.
so just staying under the wire is not necessary anymore. And I really would like to have patients have options of better health in general and solve some of these health problems using, first level things like stop eating oxalate heavy vegetables if you're in pain. Um, Eat the whole egg, not just the white. Just let's just start there. Just start there. And
Called
thinking about
education.
things from
Yeah.
a primal perspective. Was it primally acceptable for somebody to snore like a truck all night long? No. You would have been hyena meat. You would have been
Right.
attacked in the night by some giant cat. Um, Bedwetting in a 8-year old, that couldn't happen. You would be a target in your sleep all the time. You would be ingesting bugs as they crawled into your mouth while you slept on the ground if you slept with your mouth open. It's not primally feasible. It's not evolutionarily consistent to have those few things that are so common today to have been okay as a primal person. So that's how you have to think about this. Otherwise, you're going to get so confused and so mired in these twisting theories that you'll be frozen and petrified in fear of making any changes.
Well, I think Dr. Fonder's book really puts it out clearly
Mm-hmm.
what the conditions are and how to resolve them. And I would encourage people to purchase his book, The Dental Distress Syndrome, and read it because he's got a lot of answers in there
Yeah.
that help clear up the confusion. So, well, thank you, Shirley. It's been a wonderful hour. We talked about a lot of different types of information, but the most important thing is that we're making progress in our discovery of how to help the body come back into homeostasis and offer services in a profession that we know needs change. There's definitely a need for change. And what that change is what we're discussing and what our discussions are all about. And we're excited to have people come on and talk with us about these changes. So, where can people reach you, Shirley?
Our website is primalair.com, just simple primalair.com. If you're having snoring problems, if you're wondering about your tongue placement, if you've had teeth out and you're not sleeping well, that's where you'd want to go.
And I'm Victoria DaCosta, and you can reach me at drlinks, drlinxs.com. And we can discuss how to collaborate and how to have these conversations of communications between the providers. We're linking you all together
That's
with
right.
information. So thank you for joining us today, and we'll be back